Supraclavicular nerve block for shoulder arthroscopic surgery, presented by Douglas Brannon, Stephen J. Snyder, and John J. Berkowitz from the Southern California Orthopedic Institute, Van Nuys, California.
My name is Steve Snyder. I'm a shoulder surgeon here at SCOE in the Center for Orthopedic Surgery, or what we call COSI. We're going to introduce the technique of supraclavicular block today. It's a technique we often use before shoulder surgery to help with patient comfort and anesthesia during shoulder surgery, especially arthroscopy. Damien's going to be our patient today, and Doug Brennan is our anesthetist who's an expert in this, and we'll let Doug explain how we do the block and a little bit more about it.
Hello. For the block, one of the things that we do, and you'll receive many phone calls from the center, one of the discussions we'll have in the pre-op area is what we call a nerve block. So a supraclavicular nerve block, the goal of it is to help numb the shoulder area where they're going to be doing most of the surgery. The benefits of it is it decreases the amount of anesthesia that you need throughout the surgery, so making you much more stable under anesthesia with your heart rate and your blood pressure. Also decreases the amount of pain that you have in the postoperative area for about 15 to 20 hours. Everybody's a little bit different, depends on a lot of different factors, age being one of them, metabolism, or the medication. We simply use an ultrasound. We find the nerves of the area. We take a needle and we place it just above the clavicle, right kind of here at the base of the neck. And what this does is we put the needle next to the nerve, not in the nerve, and place medicine around the nerve. With the ultrasound, we can see everything from the nerves, muscles, vasculature, and the needle, and the medicine going around the nerves. The effects that you will feel from the nerve block is numbing, tingling sensation originally, which will go away, and your hand will get very numb. You'll also lose the ability to lift your hand above your head. That is all normal and all resolves within the 15 to 20 hours. That's an indication, part of an indication that our block is working. The block itself takes out the motor and the sensory part of that nerve during the surgery, which is what we're looking for to optimize your comfort after surgery. Also allows us to give a lot less pain medications or narcotics while you're under anesthesia to alleviate some of that drowsiness feeling when you're waking up, and again also helps with the nausea and vomiting. So the block itself, we use a sterile technique, and we'll clean. You'll come in, we'll clean the skin off first and get that nice and clean. And then we put a little ultrasound gel. This is merely just to help us get a better view on the ultrasound machine itself. And once that's on, we'll just grab the ultrasound probe. The ultrasound probe is painless. It's nothing more than ultrasound waves, sound waves going in. They reflect back to the beam. And here on the screen, these are some of the targets that we look at. You see the artery right there, and right at 9 o'clock to about noon, you'll see the bundle of nerves, which is kind of that white with a bunch of dots. What we do is scroll up into the anatomy where they all come together. We go look for the stop sign. We come just a little bit further, or stop light, sorry, come a little bit down from there. And that bundle of nerves right there is what we'll target for the nerve block. With the nerve block, again, we take local medication. We place a skin wheel underneath of the skin to numb up the area before we go in with the bigger block needle. The block medication itself looks a little bit intimidating. The needle is no bigger than the needle that you get for the IV. We take the needle, and we place the needle right where we put the local, go underneath the skin. We do go up next to the nerve. Once the needle is placed next to the nerve, we inject medication around the nerve. This takes about 20 minutes to fully set up, which allows for the medicine to be absorbed by the nerve. Then you'll gradually start to feel that numbing and tingling. Then your arm will slowly get weaker and weaker. The goal, one of the other aspects of the nerve block, it also gives you time to get on your pain medicine. So my recommendation is when you're sent home from the recovery room, you get home, you get comfortable, get in a chair, and then get food in your stomach and start on your pain medicine. Having any PO medication on board, you may result in some discomfort. So by doing that technique, we kind of cross at the mid-roads. So you'll have some pain medicine on board if the block wears off while you're sleeping during the night. And that's about.
Well, thank you, Doug. Thank you, Damien. Hope you feel good. Hope your surgery goes well.